Hi, I'm Gary Chimes from Lake Washington Sports and Spine, and one of the things we want to talk about today is an innovative treatment for calcific tendinitis. So what is calcific tendinitis? Well, first of all, what's a tendon? A tendon is to me an attachment where a muscle attaches to a bone. When people talk about calcific tendinitis of the shoulder, they're most frequently referring to one of the rotator cuff tendons called the supraspinatus. That's to me a tendon that starts on the top of the upper spine of the scapula and attaches to the outer edge of the ball and socket joint. So it often gives people pain when they reach overhead or reach behind their back, and it's the most commonly injured tendon in the rotator cuff by far. One of the things that can happen is little calcium deposits can form in this tendon, and historically this has been a tricky injury to treat. But we want to talk about an innovative use of musculoskeletal ultrasound to help treat this, and this is called a calcific tendinitis Barbotage procedure. Do you want to see? What this involves is using ultrasound guidance so I can see where the calcium deposit is, directing a needle down towards that deposit, and then blowing it up from the inside. The idea behind this is that the calcium deposit isn't uniform. It's like a Tool's chewing gum that has a hard, delicious outer coating and a jelly-like interior. So if you can get a needle to the inside of the calcium deposit and then blow it up with fluid, you can actually pull a lot of the calcium out. Let's take a look. What we have is a musculoskeletal ultrasound machine, and what we're looking at here is going to be the calcium deposit within the tendon. Calcium always looks white because sound waves can't penetrate through bone. So this is the normal portion of what's called the greater tuberosity, which is where the tendon attaches, and we see this big deposit of calcium in the middle. On this next picture, what you can see is a needle directed under ultrasound guidance so that it penetrates into the calcium. Once it's there, that's when the magic occurs. What we can see in this case is that we're pumping some fluid into the calcium deposit, and by pushing in and pulling out, I'm actually drawing that calcium out. I'm going to emphasize that even more on the next picture. And again, we can see the fluid going in and then the material pulling out. Let me show you what this actually looks like in terms of the syringe. This is going to be the fluid before we put it in. This is a numbing agent called lidocaine, and you can see it's a very clear liquid. This is going to be the fluid afterwards. I'm not sure if you can see, but it has powdery white calcium deposits that we basically pulled out of that calcific tendon. So the patient came in, had a lot of pain reaching overhead, had some pain reaching behind her back, had already had procedures done to try and just treat the pain associated with the tendon, but this is a new procedure. It's a different type of technique, and she said she left the office with 100% pain relief. So this is called a calcific tendinitis Barbotage procedure, and it's a really wonderful tool that we do at Lake Washington Sports and Spine to help keep you active.